The Royal Cornwall Hospitals Trust has 3 sites: the Royal Cornwall Hospital in Truro, West Cornwall Hospital in Penzance, and St Michael's Hospital in Hale. Our site rules apply to all of our hospital sites. While you are working with us, your day-to-day contact will mostly be your supervisor, main contractor, or someone from our estates department. All projects on site will be led by a project manager from the Planning and Projects Department or an estates officer from estates. If you are unsure of anything at any time, please contact Planning and Projects Direct or estates. Our health and safety team are also here to help. If in doubt, ask. If you are driving to work, we encourage you to use the Park and Ride service. The buses run every 10 to 15 minutes. Under certain special circumstances, you may be granted permission to park on site. Before parking, you must obtain a parking permit from the Q Park office, along with details of your parking location. All of our hospital sites are no smoking sites, and that includes roads and car parks. Please leave the hospital boundary if you want to smoke, and ensure you put out any cigarettes before you enter hospital grounds. You are not permitted to take drugs or drink alcohol whilst working on the hospital sites. Do not bring drugs and alcohol with you. If you do, you will be evicted from the site. Your main contractor may provide you with site welfare facilities. If not, you are welcome to use our on-site shop, cafes and restaurant. Please remove any high-vis clothing, safety hats and other protective wear that may have been contaminated on site. Ensure you are clean and tidy. These areas are also used by patients, visitors and staff. You will need to sign in to your place of work each day. This may be in your main contractor's site office or in our estates office. This ensures your activities for the day ahead are understood by you, and you will be informed of any hospital-related activities or operational plans that may be relevant to your work. Please remember to sign out when you leave each workplace. You may not have worked on a hospital site before. It's a very different environment to other construction sites. We must all be sensitive to the patient and understand they may be very sick or frail. These patients can be severely impacted by your acts and omissions. Here, infection prevention and control is vital. All of the work that you do and the control measures you work to will be approved by us. The helipad for the air ambulance is close to the hospital. If you are intending to work at height with scaffold or cranes, your project manager or estates officer must notify the air ambulance first and gain permission before you start work. When you are working with us, it's possible that you may be given permission to go onto a ward with patients in. Always make yourself known at the nurses' station as soon as you arrive. All our patients deserve dignity and respect from everyone who works here.
As you can see, we are working in a live clinical environment caring for sick and vulnerable patients, hence the need to keep noise and dust levels to a minimum when carrying out construction activities. It's important to keep the dust levels to a minimum as dust contains a number of microorganisms including Aspergillus, which can cause potentially fatal illness in vulnerable patients.
The hospital environment operates 24 hours a day, 7 days a week. Securing the site you are working on from unauthorised access, especially vulnerable persons, is essential for everyone's safety. Ensuring you maintain the security of patient areas is also vital. We ask all of our site operatives to wear ID badges at all times. Our security department carry out spot checks regularly. Before you start work, you must obtain a contractor ID card.
Yeah, you need to put it on so that everybody can see who you are quite
Okay.
clearly.
Okay, sorry.
Okay.
Once approval is received, the ID badge service will issue you with your card. Each card has a unique reference number, and you must return this card when your work has finished. When you are working near fire detection equipment, liaison with estates is essential. Isolations on the system can be arranged, and you must put a dust cover over the detector. This prevents false activations, which are disruptive and time-consuming to everyone involved. In the event of a real fire, please go to your nearest assembly point. Remember that the Fire and Rescue Service may charge for visiting the site when the alarm has been falsely activated, and this charge may come back to you. If you have an accident or are injured while at work, you must report to your immediate supervisor. Each contractor has its own reporting procedure and first aider. The hospital's emergency department is very busy and should only be used for emergencies. If you have an accident or near miss, you must follow your company procedure and inform your site manager. At this point, our health and safety team will be involved.
It was one Saturday morning when I was waiting for a labour to come in. I noticed a roll of vinyl going over and it broke my foot. I was off for 8 weeks and 2 days. It put a hardship on me because I'm self-employed, and it also put a hardship on my employer.
To report a serious emergency on site, call this number: 2999 for security. For the police, remember to use 9 to get an outside line. There's a lot of legislation surrounding health and safety at work, more than we can mention here. If you are in doubt as to the impact your actions may have, ask. It is the duty of every employee to take reasonable care of their own health and safety, and of others who may be affected by their acts or omissions at work. As you are working across the site, please be aware of the safety signs. These are to prevent you and others coming to any harm. Safety signs are erected for your benefit. Get to know what they mean and what you need to do. Red, prohibition, don't do it. Yellow, warning, danger. Blue, mandatory, must do. Green, safe condition, the safe way. Risk assessments and method statements, known as RAMs, are documents detailing how a particular process will be completed. It is commonly used to describe how construction or installation works can be carried out safely. For high-risk works, a detailed description of emergency procedures is also included. RAMs must always be approved before you commence work, and you must always work in accordance with those RAMs. RAMs are reviewed by our health and safety team to ensure no harm can come to patients, visitors and hospital staff. Safe systems of work are crucial in areas of high risk. The permit to work procedure is a special type of safe system. You may need a permit to work for the works you plan to do. Always check with a trust representative. When you are working on site, it's vital you wear the correct personal protective equipment. You should wear all or some of the following, depending on what you are doing: a hard hat, ear defenders, goggles, gloves, a high-vis jacket, and steel-capped midsole shoes. You must ensure that work equipment is suitable, maintained, and if necessary, inspected. It should only be used by people who have received sufficient training. It is your responsibility to always check equipment before you use it. This is for your safety, your colleagues' safety, and everyone else who uses the hospital. Equipment that hasn't been checked could cause serious injury to you or others. If you have to remove building waste through the hospital, you must use a skip. The skip must be filled correctly, have a closed lid, and the wheels cleaned on a tack mat before going through the building. If you do not do this, you may release dust into the hospital environment, which can be severely detrimental to the health of our patients. You are likely to come across a number of hazardous substances in your work. Many will be obvious, others will be less clear. Substances can have harmful health effects if not properly used or controlled. Cost assessments will have to be submitted for all relevant substances used during your work. But remember, it's not just your health at risk. Consider our patients and staff.
As a licensed asbestos removal specialist, we're aware that asbestos can be found in a wide range of building materials. Prior to starting any works which could disturb the fabric of a building, you must ensure the safety of yourself and others and avoid exposure to asbestos fibres. It's imperative that you check for the presence of asbestos by contacting the hospital's estate department. If during your works you uncover any suspect material, you need to stop work immediately and request clarification.
Thank you for taking the time to watch this film. The work that you are doing will make a really positive improvement to the environment for patients, visitors and staff, some of whom you may know. Everyone here hopes you enjoy working for the Royal Cornwall Hospitals Trust. And remember,